I now recognize the gentlewoman from California, Ms. Chu, for 5 minutes.
Ms. Parrott, as a member of the Ways and Means Committee, I want to draw attention to something we worked on as an aspect of the American Rescue Plan that made a considerable impact on the lives of working Americans. The American Rescue Plan increased affordability of health coverage, enhancing the advanced premium tax credit for the ACA plans. And this ensured that working families could continue to access health insurance throughout the pandemic, and included eliminating the so-called cliff that families who made just over the subsidy cutoff, which is $111,000 per year for a family of 4. Can you talk about the impact of these affordability measures? And with these important tax credits set to expire at the end of this year, could you discuss who would be most likely to see their monthly premiums go up?
Yes, thanks so much for the question. The rescue plan reduced or eliminated premium costs for most marketplace enrollees and helped spur record marketplace enrollment. If these enhancements are not extended, the large majority of the 14.5 million people who signed up for marketplace coverage this year will either lose coverage or pay significantly more in premiums in 2023. According to estimates by both the Urban Institute and HHS, about 3 million people would lose coverage and become uninsured. Over 10 million additional people would remain insured but see their premium subsidies reduced or eliminated entirely, according to HHS estimates. These premium cost increase would make coverage much less affordable at a time when people are struggling with increased costs for food, housing, and other basics. For example, the Urban Institute estimates that subsidized marketplace enrollees with incomes between 150 and 400% of poverty, which is hard to know what that means, so let me break it down, about $20,000 to $54,000 for an individual, would pay over $1,000 more per person in annual premiums. A 60-year-old couple making $75,000 would see annual marketplace premium costs more than triple, rising from about $6,400 to more than $22,000. The premium spikes may also coincide with the end of the federal public health emergency, when millions of Medicaid enrollees no longer eligible for Medicaid coverage will need to secure coverage in the marketplace, making those premium tax credits incredibly important for assuring that they seamlessly are able to access coverage. The expiration of those premium tax credits would drive up the rate of uninsured, which we've actually made progress in driving down the rate of uninsured over the last year because of both the Medicaid continuous coverage provision as well as the expansion in premium tax credits.
Well, Ms. Parrott, let me ask about, and thank you for that answer. Another thing that I think was very, very beneficial. We in the Ways and Means Committee are proud of the tax credits that we enhanced, like the child tax credit. And there was another tax credit that had a major positive impact, not only in the finances of struggling businesses, but on our ability to fight the pandemic. The American Rescue Plan created paid family and sick leave tax credits that reimbursed employers who offered their workers paid time off because of the COVID pandemic. And to be eligible, businesses needed to give employees paid leave to quarantine, get a vaccine, find a test, or care for a family member or child. Can you talk about the impact that this paid leave had on both employers who claimed the credits and workers who were able to take the time they needed to care for themselves and their families without losing their jobs or their paycheck? And what lessons can we learn from these credits as Democrats work to pass a national comprehensive paid leave plan?
Yeah, paid leave is a really good example of a place where, because of our underlying policies, we tried with some success to sort of fix things for purposes of the crisis. So we added some temporary paid leave measures, and for those who were able to benefit, I think those measures were quite helpful, both in stabilizing families' incomes when they needed to take time off, and helping employers and employees stay connected. But the real, and you talked about this at the end of your question, the reality is that the United States stands alone among most wealthy nations in the world in not having some kind of paid family medical leave program for workers. And because of that, When people are unable to work because they need to care for their own illness or an illness in their family or welcome a new child into their household, too often they are forced to separate from their jobs. That's bad for the economy and it's bad for families. And so, trying to shoehorn something during the pandemic provided some help to some people, and that's really important. But the real path forward is getting to a place where all workers have access to paid family medical leave when they need it.
Thank you. I yield
The
back.
gentlewoman's time has expired. And now recognize the gentleman.